On Sunday, the National Cathedral in D.C. tolled its morning bell once for every 1,000 coronavirus deaths in our country, officially marking the grim milestone of 200,000 souls lost. Tonight, the president spoke, as we said, in front of two large crowds in Ohio, where attendees were closely packed in together, pre-pandemic seating. Again, he touted his administration's rush for a vaccine. Signs of Trump's October vaccine surprise, at least the possibility of it, are alarming scientists. Kaiser Health News reports, quote, a growing number of prominent health leaders say they fear that Trump will take matters into his own hands, running roughshod over the usual regulatory process. We are so happy to have with us again Dr. Nahid Bhadelia, an infectious disease physician, medical director of the Special Pathogens Unit at Boston University School of Medicine. She worked with the WHO back when we were a member nation during the West African Ebola pandemic and is among our medical contributors. So, Doctor, perhaps in the September air today, you detected the whiff of autocracy. When the CDC statement came out over the weekend, those of us who read it, and a good number of people reacted on social media as if to say, okay, this makes sense. It's aerosolized. They've learned more, so they're tweaking the guidance. The guidance has gone away. Who are we left to believe in a pandemic if we've now diminished the believability of the CDC?
Brian, I just want to start by saying Mara Gay's words in that last segment and just reflecting on this 200,000 people dead. You know, I'm heartbroken. I'm heartbroken as a healthcare worker, as an American, as someone who's worked in outbreaks. You know, you and I talk about this West Africa epidemic. When we left that in 2015, you know, we said 11,000 deaths. This will never happen again. We will build resilience. And it is heartbreaking to watch our country with this resilience, with its resources, suffer so badly in this pandemic for something that could have been prevented, you know, and the thing I think that breaks my heart as a public health expert is watching this credibility of our public health organizations just daily diminish. It's been this steady but consistent narrowing of the sources of information from this administration from the beginning. You know, we stopped hearing independently from the CDC scientists. We started having those COVID task force meetings. We stopped having those COVID task force meetings. We started hearing the CDC's morbidity and mortality weekly reports are being manipulated. We saw the FDA tout the evidence around a treatment that wasn't as effective as they said it was. And now you see these changes in the CDC guidelines. I've worked in other countries where you've seen fledgling democracies or governances that are not that strong, where they do this, where they try to power grab or control information. I guess I just never expected to see this in this vibrant democracy of ours. And your concern is right. I hate to say this, but as we get to this release of vaccine, it's great to see the transparency from the manufacturers releasing their protocols. I worry that we might need more eyes on this. And one thing that we could do, I think, is there's an organization, for example, the National Medical Association, which is a organization for Black physicians by Black physicians that was putting together an independent task force looking at vaccine data. We may want to ask for that, having an independent task force with other professional organizations that look at the data. And I think the White House and the HHS should accept that, should promote that, because it might actually help with vaccine hesitancy. It might help set people's minds at rest.
And to the point you just made, can you understand that people might have reason to doubt a vaccine that the president is all but telegraphing to us may have been rushed to market to facilitate a re-election campaign?
I think we just have to see what happened the night before the RNC, when you saw the FDA sort of come out with convalescent plasma, you know, touting this as this miracle treatment, which is not. We've had access to it. We haven't seen it sort of change the field. It's been incrementally helpful. So yes, it does make you wonder. It makes me wonder. It makes many wonder. There is there is a likelihood potentially that we might have a vaccine. But politicizing it in this way or rushing the timeline is only eroding the trust in the process even more. Using it as part of a political campaign rally as a talking point is only eroding the trust in it even more. I will just end with this. 200,000 dead. I don't remember seeing a statement marking or reflecting this from the White House or the president or any member of the COVID-19 task force. Maybe I missed it, but we're grieving as a country, and I haven't seen that from the very people who are responsible for this response.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.